Having a contraction? Drop in your shoulders. That's perfect, just like that. Blow it through.
In a few short hours, Carla Taylor will be holding a newborn baby in her arms. But for now, she's just trying to deal with the labor pains. Who's helping her through it? A partner, a sister, a best friend? No, a doula.
Well, a birth doula or a laboring doula is a trained professional. It's a woman who's trained to go in and assist another woman and her husband or her partner during the laboring process.
Marlo Robinson is a registered nurse and a doula. She also trains other women who want to become certified doulas.
How does that feel? Does it feel? Yeah, it really does. And the one thing that I've learned and that I teach other women as they're going through this training to become a doula is that that woman's birth experience will last forever. She may not remember what she had for dinner the night before, but she'll remember that birth experience for the next 70 years, and it's the truth. So we're there to facilitate and promote her birth experience. Just relax and expand that area. It feels so good.
One of Marlo's clients is Amanda Citron. She and her husband David are expecting their first child very, very soon.
We decided to have a doula because we didn't really have, I don't have, my mother had passed away and I didn't really have support other than my husband who has never given birth.
Look at David and then slow deep breathe in through your nose and out through your mouth.
The Citrons interviewed 2 doulas and chose Marlo because they felt their personalities clicked.
So just kind of push in. We'll sit down and take a couple of hours and find out what do they want for their birth experience. And we talk about different comfort techniques from massage to aromatherapy to acupressure to just position changes and using water for labor.
A birth doula will stay for the entire labor, no matter how long it takes.
But she's there for the duration. There are no shift changes for the doula. And then she stays for a couple of hours postpartum, and then she typically will follow up with a postpartum visit.
Like many fathers, David was a little apprehensive about having an unfamiliar person in the labor and delivery room.
I had mixed feelings about, what the doula would bring, because on one hand I knew that she would take pressure off of me, but on the other hand I thought maybe she would kind of be in our way, because it's a private thing.
But that feeling quickly changed, in part because Marlo made a point to include him in the process.
They had us, at one point they had us dance to help with the gravity, to bring the baby down, and the doula actually stood behind him and showed us what positions would be best, and then casually backed out of it, and so it was just the 2 of us. It didn't interfere with our birthing experience or our privacy.
I was very glad the doula was there at the end. She really took care of everything. She took all the pressure off of me, and she made my wife very comfortable. The doula could give us all her time. She was there specifically for us.
Although Marlo is a registered nurse, doulas are not medically trained to deliver babies. They're there to provide support and make mom and dad more comfortable. But only a doctor, nurse, or midwife will actually help deliver the baby. Still, multiple studies have shown that there are real medical benefits to having a doula help a mom through labor. The presence of a doula can decrease the woman's chances of needing a cesarean section. It can decrease her need for an epidural or other pain medications, and it can help facilitate bonding and breastfeeding once the baby is born. It's been several weeks since Amanda and David's baby Ethan came into the world. He's healthy, they're happy, and the birth couldn't have gone more smoothly.
Oh, I cried. I felt I needed a postpartum doula for the emotional and physical support.
When Stacy Weckstein became pregnant with her second child, she figured she might need some extra help when the baby finally arrived.
You don't know how you're going to feel after the trauma of giving birth. Physically, you're tired, and having 2 children, now I'm running after a 2-year-old and having to nurture a newborn. I think it's really important to have that extra person there who's been through it so many times and has all that experience with so many babies to really get you on your way.
So Stacy hired Novia, a nurse and postpartum doula.
I love people. I love babies. And it's my pleasure helping someone in need and helping them to the best of my ability in whatever way I can.
I interviewed 2 doulas, and I picked the second person that I interviewed because I felt like she answered my questions. During the interview, she asked me questions. She was interested in my family situation and how I was feeling.
Some moms may opt to hire a live-in doula for several months, while others, like Stacy, may feel they need assistance only a few hours a day for a few weeks. What do doulas do in that time?
We make sure that the babies are well secured and well fed, clean and everything, so that the mothers can feel confident and get as much rest as possible.
If I need to take a nap, she'll take the baby. If I need any information like how many ounces is right, they have that information available and that support available.
Sometimes just talking to them means a lot to them.
And, sometimes it's as simple as making a meal and giving her a back rub and sending her off to bed. And sometimes it's more involved. We, do light housework, but we're really there to do whatever she needs us to do to support her emotionally and physically.
Of course, like all good help, doulas can get expensive. Many charge an hourly fee, while others will negotiate a daily, weekly, or monthly rate.
That I don't think there's room in this profession to ever say to a woman, sorry, you can't afford a doula, can't have one.
A postpartum doula can do everything from helping a new mom learn to breastfeed to washing the dishes. Obviously, that's an added expense that many new moms will have to stretch to afford, but Stacy says the extra help is worth it.
Definitely worth it. If you were to hire somebody who didn't have that kind of training, you would be spending less money, but you would be taking more of a chance on whether you're getting the right kind of care.